Hi, everyone. Welcome to our newest edition of Nashville General Hospital's Wellness Wednesday Facebook Live program. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. Last week was Pre-Anesthesia Recognition Week, and today we have Joshua Baxter, Clinical Director of Perioperative Services at Nashville General Hospital. Josh Baxter is a certified registered nurse anesthesiologist, and he will be sharing information on anesthesiology from perioperative preparation to post-operative recovery.
Josh received his Doctor of Nursing Practice from the University of Alabama at Birmingham, his MBA from Cumberland University, and his Master of Science in Nurse Anesthesia from the Middle Tennessee School of Anesthesia. Please welcome Josh Baxter.
Thank you, guys. I know it's a mouthful sometimes to say that title, so you did great. So I'm pleased to be here, and I'm pleased to talk to our community. Anesthesia is something that a lot of people have high anxiety about when they're having surgery. And so it's my goal is to make you become more familiar, what questions you may have to answer. If you're found in the position where you need anesthesia, you know that you can ask any question to any provider, and hopefully this will calm some anxiety and inform you. So let me go ahead and share my screen and we will get going. If you guys will let me know, did that pop up? Are you able to see my presentation, guys?
Okay. Yes.
All right, so we're going to talk about perianesthesia. And what is perianesthesia? That's a global discussion of, it starts actually in your physician's office before you come into surgery. It's including the anesthesia during the surgery and the post-recovery phase. So we have pre, intra, and post, and we'll talk about that as we go along. Let me advance this slide. So what is anesthesia? That's a good question. It can be many different things, but the technical term is anesthesia is a medical treatment that prevents patients from feeling pain during procedures like surgery, certain screening tests, diagnostic tests, including tissue removal, biopsies, and dental work. Within the umbrella of anesthesia, there's different modes of anesthesia. But why do you need anesthesia? Well, most of us do not want to feel pain or an unpleasurable sensation. So anesthesia works depending on the medications we give. It temporarily blocks sensory and pain signals that relay those informations to the brain. Okay, your peripheral nerves, as we know, connect to the spinal cord and relay that up there. So what we do is we have great medications that can block that, so you have an enjoyable experience and not experiencing pain. Who provides your anesthesia? Usually that'll be an anesthesiologist or a certified registered nurse anesthetist, also known as a CRNA. So that's my title. It's much easier to say CRNA than certified registered nurse anesthetist. In the state of Tennessee, you have different types of settings. You have team settings where the anesthesiologist and certified registered nurse anesthetist work together. That's what we have here at Nashville General. You have different practices where it's just anesthesiologist or just nurse anesthetist, but the most common is a care team model that we provide here. So what are the different types of anesthesia? Okay, most people probably just assume when we say anesthesia that you're going to sleep, but that's certainly not the case. We have general anesthesia, which is the most common type, is where you're in a state of unconsciousness, where you're asleep and do not feel pain. We have local anesthesia. This is very typical of what you'd see in dental offices, where we just numb up a certain area. You don't have to be asleep or sedated for that. Regional anesthesia, this is typically, as we'll talk about in just a minute, where we numb up a certain area of the body. Most commonly, most women can relate to this if they've ever had an epidural. Okay, we're just limiting pain sensation to a specific area of the body. Or sedation, this is where we provide a light sleep, but you're still readily arousable. And this is most common where we see when we have outpatient procedures like colonoscopy or heart caths. So let's look at a little bit of this a little more in depth. So general anesthesia, this treatment makes you unconscious or asleep and insensitive to pain or other stimuli. General anesthesia is used when we have more invasive surgical procedures or procedures of the head, chest, and abdomen. Again, this is the most common. This is typically, say you're having your gallbladder taken out, your appendectomy, hysterectomy, joint repair. That's something you would see with general anesthesia. And this gives a lot of people, a lot of anxiety, and that's normal. And I want people to understand that it's normal to be nervous, especially the day of surgery or before. And, we want you to ask questions. And if we are explaining things to you for the procedure and you don't quite understand, always ask for clarification. Even though I do this every day, I still would be nervous and I would still want to ask questions. And it's okay. Nobody will ever take offense to that. And we want you to be fully informed and at least take your mind off of the anesthesia component of your surgery. Local anesthesia. We can use local anesthetics, and typically you might have heard of lidocaine as the most common. This only affects a small part of your body, such as a single tooth. Okay, this is what you're numbed up with when you may get a root canal or a cavity filled. We can also use it for cataract surgery, which is very common, where we just put the medication on the drops go into your eye. So that allows us just to numb up the eye. We don't need to make you go all the way to sleep or give you other more medications or anesthetic gases. It's just specific to that area of the body. Okay. We can also numb up just certain areas of the skin if we're getting biopsies, taking off a mole, something you don't have to be sedated for, and you can be in and out and back up to your normal functioning very quickly. And it's important to know with this is you're awake for this procedure. Now, we can certainly give you some medication to help you relax, but most people like this option because they can be quickly back on their feet, back to their job the next day, and this is a quick recovery. Regional anesthesia. Regional anesthesia is much more common than it used to be. And you're seeing this more and more at facilities, especially with the opioid epidemic. And we in Tennessee know that that's a very big problem. A lot of individuals that come to us, they don't want a lot of pain medication. And especially the side effects, such as maybe nausea and constipation that goes along with post-procedure narcotics. So what we can do is offer regional anesthesia, and this is a great benefit to our patients that we do provide here. This is a block that blocks the nerves to a specific area of your body, such as a limb or something below your chest. So if we're working on the arm, the leg, we talked about epidurals for when you're having a baby or a C-section, certainly stuff like that we can give you, and is short acting, and you don't have all the side effects of general anesthesia or need a lot of postoperative narcotics. Okay, so this is great for individuals that just are very sensitive to pain medication or do not want to be on that. And we can actually leave these in if you have to stay in the hospital for a day or two and run that so we don't have to give you as much narcotics. And it's a great alternative for our patients. Sedation. Sedation just relaxes you to the point where you'll have more natural sleep, but you can be easily aroused, okay? And that's the difference between general anesthesia and sedation. Typically, sedation, we see these with colonoscopies and heart caths. This is just to make you comfortable for the procedure, but not necessarily going all the way to sleep. You will always have an anesthesia provider here with sedation. So we're monitoring your heart rate, your oxygen status, your breathing, making sure you're safe. And again, this is the type of procedures that you do want an anesthesia professional for. So you have somebody there monitoring and taking care of you. So those are typically the 4 different types of anesthesia. And this is something too, when you come in and speak with one of us at the pre-admission testing or the day of surgery, if there's questions of, is there any alternatives to go into sleep because, it may be anxious or claustrophobic, ask. And typically we'll give you options as well if it's possible for that procedure so that you can help make a decision, but also what's best for you. Just like anything else, anesthesia is not cookie cutter. We try to tailor things if possible to benefit you and the quickest outcome and speediest recovery for you. So feel free to have those conversations with the providers you're talking to. And a lot of times we love to, not do the norm and give you something to make you feel better about the whole situation and a quicker recovery. So how is anesthesia administered? Okay. And again, it depends on the type of the procedure we're doing. But typically, if a general anesthetic, you'll receive some medication in your IV that drifts you off to sleep, and we keep you asleep with the anesthesia gases. Okay. And once the procedure is done, we turn those off and we wake you back up. Now, if we're doing regional or local that we talked about, that could be medications such as drops in your eye, the numbing up of the skin or the dental area. And that's just a localized that we talked about. So they could be some injections, but for the most part, is typically medications in your IV with the anesthesia gases. Now, the biggest question I always get every day is, do I have to get a shot? Do I have to get an IV? And unfortunately, yes, you do have to have an IV, but it's not as bad as you think. Usually that's the worst part of your day. Okay. We have great nurses here in our operative area that are great. We start IVs as well. But that IV is what we use to help you drift off to sleep. We give you pain medication and nausea. So yes, you do have to have an IV, but we try to make it as comfortable as possible. And don't forget, you can always ask the team, hey, can you numb up the area right before where you start your IV? And it makes it less painful. We know that we do have nerve endings on our hands and arms that are very sensitive. That's their job. So there's different modalities we can help to make it easier for you. So please don't hesitate to ask with that. But yes, you do have to have an IV for safety reasons as well, and for us to do our job. So we can't get around that. So otherwise, it's a pleasant experience. So how should you, as a patient, prepare for anesthesia? Well, if you've been through this before, you probably know you're asked a lot of the same questions over and over again. And that's not because we're not paying attention. It's because those are safety measures that we ask. We will ask your name, your date of birth. With every encounter you have with each provider, that's just a safety measure. We'll ask what procedure we're doing. If that procedure is on a specific extremity or body part, we may say, is it right or left? We want to make sure you are who you are. We're doing the right procedure and you understand. So it's not that we're paying attention, but that's a safety measure, and that's built in so multiple people, if something's there, we can catch that. So sometimes I have a lot of patients ask me, well, I just answered that question, or why are you asking me again? It's for your safety. Okay. And we ask you to verbalize that, and we're always want to prevent mistakes or errors. Everyone's human. And if you have 4 or 5 people asking the same questions, you're more likely to catch something than one person. So it's not that we're not paying attention. We're just trying to be safe and thorough. Okay. So how are you starting to prepare? It will start in the office with your surgeon or provider. They will probably talk to you about the procedure and give you options. And if that option includes surgery, they will start to ask questions there. They will take a health history. They will record your medications. And also to remember, something that a lot of people forget is any over-the-counter and herbal medication count. Okay, and that's very important to us as anesthesia because a lot of people don't realize that certain herbal medications, not that it doesn't help you, but there are potential side effects. A rule of thumb is any herbal medication that starts with G will increase bleeding. So gold, ginkgo biloba, ginseng. So a lot of the common things that you probably heard about, you wouldn't really know as a side effect is increased bleeding. And normally that wouldn't be a problem, but if you're having surgery and suddenly you start bleeding and we don't know about it, that's where us having a complete medical history comes to play. So you'll hear us ask about medications, any herbal over the counter. It's wonderful if you can provide us with a list or bring the medications with you. And down here at the bottom of the screen, you see pre-admission testing. And that's where you come into the hospital before your surgery, you meet with one of our nurses. They review your health history, your medications. So it's critically important is when you do come in is either you bring your medications with you or you have the most up-to-date medication. It's very hard, and I'm the world's worst myself when you think, oh, I take this, it's the blue pill for blood pressure. Well, there's 100 blue pills out there. So, or I take this over-the-counter medication. So it's really important that you have an accurate list or just bring the bottles in with you and we can take the list because that is crucial for us. An up-to-date health history, we'll review that with you guys. Things that we like to know is, how is your heart? Have you had any heart attacks in the past, chest pain? Are you able to exercise? Your lung, strokes, important stuff. But if there's anything that we have missed or something that you think is important, always let us know. And we'll talk about some of the complications that may be associated with anesthesia later on. But if you ever had any family members that have reactions to anesthesia, maybe they were long to wake up or had high fevers, this is where we need to know. And we ask about that. Feel free to tell us everything that you think is important because, it's good when we're having a dialogue with each other that we're human. We may skip over something or omit something. So it's important you keep us on our toes as well. So what happens during anesthesia? Once you go to sleep, do we simply just do our crossword puzzles and have some coffee? No, nothing like that. We monitor you the whole time. We're with you from beginning to end, okay? Depending on the choice of anesthesia. If we're going a general anesthesia, you'll get some medications to help you relax. We go into the operating room. We put monitors on you that monitors your blood pressure, your heart rate, your oxygen level. Okay, so that's continuous monitoring that we have on you the whole time. If it's a general anesthesia, you will get a breathing device, typically a breathing tube. If it's sedation, you'll get a nasal cannula. It can be very itchy, I know, but it does have to stay in for the procedure. But we are with you from beginning to end. And I think that's probably one of the scariest things for individuals is once they feel they're going to sleep and you do lose that control, who's taking care of me? And your anesthesia provider will be with you the entire time. We monitor your vital signs every 3 to 5 minutes, every 1 minute if needed. You have continuous monitoring and you have an entire team with you. You have your surgical team, your recovery team, everybody's there. Okay. And also our job includes post-surgical pain management. So when surgery and anesthesia component doesn't end when you wake up, that continues into the recovery room where we manage your pain, nausea, making sure you're comfortable, you're awake enough to go home. So it's a complete continuum starting when that first pre-admission visit on into when you're being discharged home. What should I do after getting anesthesia? This is a question I get all the time. When you have a procedure and you do get anesthesia, you want to make sure you take the day off. You want to make sure you don't plan any important events. First and foremost, you cannot drive yourself home. That's a question we always get. No, we'll coordinate with a provider and everything. We don't want to put that at risk because you still may be a little groggy. Like I said, we want you to rest the rest of the day. We don't operate or drive heavy equipment. I have individuals, can I go home and mow the yard? Or I need to do some work around the house or farm. No, you can't do it that day because we don't want you to injure yourself. You don't want to be mowing your yard and fall off the lawnmower and come back for something else. You don't want 2 procedures in one day. So take the day off for yourself. Your body needs to rest and recover. You've probably been anxious. You may not have slept well the night before. That is very common. So take the day for yourself and rest. Do not drink alcohol for the first 24 hours afterwards, and only take the medication that is provided to you by your provider or your anesthesia team. Okay. And also, you're not allowed to make any important legal decisions for 24 hours. So don't change your wheel, sign your car over to anybody else, because remember, as we talk about, anesthesia will stay in your system to some bit for 24 hours. So you don't want to make any life-changing decisions. And these are all questions that have came up. So again, this is good to know. And just remember to take the day off for yourself. So what are potential side effects? This is another very common question I get. And with anything we do, there's always a chance for side effects and complications. The most common, depending on what we're doing, is you might have some back pain or muscle pain from the area the procedure's done, or maybe laying on your back for the procedure on the OR table. You can have some chills. It's very common when you wake up from surgery that you have some shakes, and that's just your body's response to that. Doesn't necessarily mean you're cold, but typically you could be a little cold, especially if it's a long procedure, but we do have devices that keep you warm, and we monitor your temperature continuously. Depending on the type of surgery, you may have a difficulty urinating if it's a procedure related to urology, gynecology, and those things we monitor and make sure you're able to go to the bathroom before you go home. The nursing team does a fantastic job with that. You can be tired. You may think, oh, I just had a couple hours of sleep. Why am I tired? Remember, we're very anxious. You may have not got rest before. It's common for the medications also to make you feel tired for up to 24 hours. So again, that's why we tell you to take it easy and to go home and rest. Okay, but it is very common. Headache, itching, probably the most common on this list is itching and nausea and vomiting. Okay, there's not a worse feeling in the world, as we all know, is to be nauseated. And that's a big fear for a lot of people, that I'm going to wake up nauseated, especially if you have a history of that. We have really advanced the practice of anesthesia over the last few years and decades, where the medications we have now available work wonderful for nausea and vomiting. We usually use a combination of medications, especially if you have a history of nausea and vomiting. If you've had this type of reaction, say you had surgeries in the 70s, 80s, or before, it's much more common to have nausea and vomiting then than we do now. And that's a good conversation that I have with a lot of patients who've had this experience decades ago, but have wonderful results now because of the medications and the newer medications that are on the market for us. Itching is very common as well, and this is usually a typical side effect from pain medications, and we can give some medications to help relieve itching. And as we talked earlier about the different modes of anesthesia versus general versus regional, this is a good option if you have a reaction to pain medications, of us doing a local or regional block, so you don't have to take that pain medication and have those adverse side effects. We can have pain and tenderness at the injection site, maybe your IV site. It could be a little tender for a day or two. That's very common. Usually alternating hot, heat and ice will help with that. The most common side effect from us from anesthesia, if we use a breathing tube, is you will have a sore throat. And usually that lasts for a day or two, maybe up to 3 days. And that's very common to have a little sore, scratchy throat that typically goes away with time. But just to keep that in mind, is all of these are potential side effects. It doesn't mean anything went wrong or anything, but it's certainly stuff that we can help and take care of, but to be aware that it does happen. What are the potential risks? Okay, this is kind of the scary stuff people ask about, and there's always risk for something, but what I always tell my patients first is there's a risk with anything we do, but having these complications are very, very rare, and there's safeguards in there to help from that. One of the things I always ask is, when you go under anesthesia, will I be awake? Will I wake up? You know, we've seen all types of stories, movies, stuff like that. The reality of it is waking up anesthesia is very, very rare. Okay. And it happens almost just, it's very rare. I wish I could give a number or something, but it's the way it's maybe portrayed in TV series and movies. It happens all the time. And I think a lot of people think, is it going to happen to me? No, it's very, very rare. Also complications, you might have a collapsed lung, depending on the type of surgery, nerve damage, postoperative confusion. That's very common in our elderly population, especially if it's a long surgery, and that usually goes away within the first 12 to 24 hours. One thing on here is something you may or may have not have heard, is malignant hyperthermia. And this is a very rare disorder in which people have a reaction to anesthesia. Okay, it's an inherited disorder. So if you've ever had someone tell you that they had trouble waking up, or they developed a high fever, or had to go to the ICU after surgery, that always piques our interest. So we'll follow up with that, and there's ways to prevent that. So again, it's a very rare disorder too, but it's certainly out there, and everybody needs to be aware of those type of disorders. And we might ask more specific questions, and we can have ways of preventing that. So how long does it take to recover from anesthesia? This is always another great question. And a lot of times it just depends on your procedure. What we do tell people is that the anesthetic drugs stay in your system for up to 24 hours. So that's why we advise you to rest, not operate heavy machinery, drive, anything like that, sign legal documents, because the medication can stay in your system up to 24 hours. Usually after that period, you're good to go. Again, everybody's a little different. For most patients, it's about 24 hours or less that the anesthesia medication will stay in your system. When should I call my healthcare provider? Okay, this is always something that, you're home, do I call somebody? Is this normal? So I'm glad we're doing this presentation. You guys asked me to know, we know what side effects are, or is this not a side effect? Maybe I need to follow up with my provider. Certainly, if you ever have an experience of difficulty breathing once you go home, chest pain, extreme itching, hives, or swelling that's maybe not relieved with Benadryl, numbness or paralysis outside of the area we worked on or the expected time frame, slurred speech, difficulty swallowing, okay? Anything else that you would normally want to reach out to your healthcare provider, you can certainly do that as well after surgery. There's no certain time frame. So anything, I always say call and ask. It never hurts to call or ask any of us. You have anesthesia staff here on 24/7. You have your surgery staff, your clinic staff, and everybody's here to answer your questions. There's never not a time you shouldn't call. All right, so discussion. So this is where I open up to any questions for you guys. The goal of this was just to provide you guys an overview to help ease some anxiety, maybe what you expect when you come in here. So I hope that's helped. If you see me when you come in here, please say hello, ask questions. I've been here for, I think, Kathy knows. I've worked with Kathy a very long time, maybe 13, 14 years. So I've seen a lot of patients come through, and I'm very proud of the services we offer here to our patient population. And we do have a team-oriented approach, and we really do want to make you feel comfortable and feel like family when you do come here. So please ask any questions related to your anesthesia care, not on this discussion. If you see us around here, we really want you to have a great experience.
Well, thank you, Josh. Thank you for that phenomenal presentation today. I definitely have learned a lot of information. I'm sure all of our viewers out here in the digital world have learned a lot as well about anesthesia and just how to prepare more for surgery. Because I think, to your point, and I really appreciate your transparency with opening up and saying, it can be scary. Everyone does have those questions about, am I going to get up off the table once you put me under? What's going to happen to me? So I definitely appreciate you putting that out there and being so open about and vulnerable about, like, yeah, it can be kind of scary, but this is how, that reassurance of this is what we do to make it better.
Yeah, I think that's probably the biggest thing we encounter is people, it's a scary time, whether you're having surgery, if it's to repair a joint, or maybe it's surgery to, take out a cancerous organ, tissue. It's not only scary that you have that disease that's going on, but now you have surgery, anesthesia. What does this mean? And these are real valid concerns. And I think what I'm very proud of the team here is you're not just a number to us. You're not just another patient on the table. We want to make sure you're very taken care of. I always tell my team, always consider the patients there. How would I take care of my grandmother, my family? Take the time to talk, answer questions, alleviate fears. And, sometimes, the fear is just all consuming, and it just takes a minute or two to explain things and to let people know that somebody's going to be with you the entire time and that they're looking out and they're going to treat you like family.
And while you were speaking, I know that you did talk about, I guess after post-surgery, after someone comes up off the table and their reaction. So we actually did have a question someone sent in, and she asked, is it normal for a person to wake up from anesthesia and be confused or combative? And I know you
Yeah.
talked about that confusion. Um,
Yeah, no, it is. So, it's kind of like we're giving you medication to go to sleep, surgery's over, we're turning that medication off and let's wake up like that. And it doesn't normally happen like that. You're going to be groggy. Kind of think about, I tell people when you first wake up in the morning, some mornings you wake up wide awake. Some you're kind of like, oh, I need 5 or 10 minutes to wake up. Everybody's a little different. And especially, in a different environment. And that's the thing. You're not waking up at home in your own bed, your own family members. You're waking up, you see bright lights, you hear instruments, and that's why it's very important. I always speak to patients in their first name. Mr. Smith, or is it okay if I call you John or Pam or whatever? So when you're waking up, it's like, Mr. Smith, this is Josh. You're just waking up from surgery. So when you can hear that, because the first thing, the last thing to go away, the last sense that goes away is hearing. And the first sense that comes back when you wake up is hearing. So if you can hear somebody telling you everything's okay as you're going to sleep and you hear that coming up, it really does help individuals. But yes, we certainly have that. And I tell you, the meanest left hook I've ever seen was from a 90-year-old that got me good. But you know what? We get through that. But it happens, but it's a confusing place. But if you can say familiar things and the patient knows their name, where they're at, that reassurance, it typically brings the situation under control.
Perfect. See, and I had some questions about, so what are some ways or what are some factors that can contribute to increased complications? Because I know a lot of times when you think of, I know smoking is one, correct?
Yeah, smoking is one. So you'll hear us say, even starting in your surgeon's office and when you come to pre-admission testing, smoking is a reality. Okay. But we do advise at least to stop smoking for the first 24 hours. And why is that beneficial for you before your surgery? One, it helps with the wound healing of the surgery. Smoking will delay wound healing. Smoking interacts with our anesthesia gases that we use to keep you asleep. So patients typically will wake up coughing more, especially in the first day. And that's something that I always tell my patients, you may wake up coughing and that's normal, okay? But certainly it's something that we want to make sure that we can avoid, and that also that we can, we don't want you to get a post-op wound infection. So it's not just us saying, oh, you need to quit smoking. There's some real reason behind that.
And then I know that you spoke about the process when it comes to children, but is there a different process for children when it comes to anesthesia, and how do you all navigate that?
Well, all the medications we give is based off your weight. So certainly with the smaller the individual, the more specific we have medications, and everything's a little smaller. We have smaller breathing tubes, we have smaller stuff, but we follow the same process. Typically, though, with children, we involve the parents more. We allow the parents to come back with us to the OR and help us let the child go to sleep. A lot of things that we use is, they get to draw on the mask that they're going to wear, the breathing bag that we use. We can add different color smells that are more enjoyable, maybe than just plastic or something like that. So we try to involve the child as much as possible so that it's not a traumatic experience, because again, it is very scary, especially if you have no concept of what's going on, but at least having familiar family or feeling some control makes it a much enjoyable experience for patients and their families.
Thank you for answering those questions.
I really appreciated you talking about how there are a lot of people involved in a patient's care and the different steps before, we're doing things for their safety. So the fact that, you're going to be asked more than once your name, your date of birth, and what you're here for is more about the patient safety, not because you guys just want to keep asking questions all the time. And I think that's really important for people to hear. Also, you had mentioned post-op narcotics. You just briefly talked about that. So has the opioid crisis kind of changed the way you guys have to go into surgeries, and then, what you would normally prescribe post-op be different?
Yes and no. Our immediate need is to take care of the pain in the short term. And, that's the goal, to make sure everybody has a comfortable procedure. This isn't something, long-term that you would see maybe at the clinics or something. But it's certainly, we need to be aware of that as providers is, what are we prescribing? Is it enough for just that period? It's not, you don't need a week's worth of a supply of something, but also some alternatives. And certainly regional anesthesia has been such a huge factor for us that, we don't have to prescribe all these medications, because we have some really bad side effects from pain medication, not just the addiction, which is huge. It's, pain medication slows everything down. Patients get constipated, which could lead to other problems, nauseated, reactions with other medications, confusion, the ability to go back to work. So it's not just that, but what I think overall nationwide, especially these last few years, is taking everybody to take a step back. How are we been doing things? What can we improve things? And how can we make this specific for this patient? There's not just blanket prescriptions of everybody that's coming in that's getting a hysterectomy is going to get this, this, and this. What's specific for this patient? Because all three of us on here, we may all have different pain tolerances. We all may have different reactions. So what I've seen, especially over the last 5 years, is things have become very specific to the patient. And I think that's been very beneficial for everyone.
And I like going to the OR area. It's just a really great group of people. You just walk in, everyone just is kind of family. I know we always say Nashville General is family, but there's just something special on that third floor. But you've talked about how we've known each other a long time. Talk a little bit about your path, like how you became a CRNA and then getting your doctorate.
Yeah. So we have, and full disclosure, me and Kathy have been friends for the longest time. Even though I'm an Alabama fan and she's an Auburn fan, we have proven that we can still get along and work together. And she reminds me very clearly every time that Auburn beats Alabama. So I will say that.
Not lately, only basketball.
Yeah. But the one thing I think that does set Nashville General apart is we are family. Most of the people up here, we've worked together for an extended amount of time. It's not a place where you're just a procedure that's coming in, getting out. We want to make sure that you have everything you need. So that makes us unique in the city when there's multiple choices. How I became a CRNA, I had a family member that was a CRNA and kind of introduced me to that. And, it's maybe not something you've heard of or familiar with for a lot of people. I did get my nursing degree from the University of Alabama, Huntsville. And then I came up to Nashville to go to anesthesia school. I went to Middle Tennessee School of Anesthesia. And I graduated in 2007. I can't believe it's been that long ago. And then actually Nashville General was a rotation when I was in anesthesia school. It was my very first rotation. And then I love the people that worked here, and it worked out that I got a job here. And this was really the only place I wanted to work in town. So I was very fortunate of that. It's a good group of individuals here that work well together. After completing school, I decided to go back to get my doctorate. And I actually used my research study here at Nashville General. I looked at the utility of drug screens and the outcomes of anesthesia. Should we be looking drug screening everyone or just specific, and how can we reduce costs associated with overcharges. And that was actually published in 2012. So we were able to get some recognition for the hospital and the work we do here. And then I received my MBA in 2016. And in the last year and a half, I've been serving as the clinical director of the operating room, which has been fantastic. I'm still an active practitioner with anesthesia, but this side of it I've really enjoyed, and how we can make the organization better and better for our patients. And I'm always open to talk, and I have a lot of individuals come through asking about how do you become a nurse anesthetist and that. And it's a wonderful profession. I think there's opportunities out there, but certainly it's an avenue to go in, and I truly, truly enjoy the job I do.
Well, I think that is all the time that we have today, Josh, but we really appreciate you for coming on to our Wellness Wednesday segment and giving us all of this vital information and knowledge that I'm very sure that all of our viewers were happy to be able to listen to and hear. And if you guys have any other questions or any information that you want me to share with Josh, please make sure you continue to comment in the chat box, and we'll make sure we send it right over to him. And then if you have any additional questions, like I said, for a doctor specifically, or you would like to see one of our providers, please call 615-341-4968. You can also visit our website at nashvillegeneral.org.
Thank you guys for doing this. I hope it was beneficial to anybody watching. And if you see us around, don't be a stranger, say hello. And thank you again for doing this.
Thanks so much, Josh, and everyone else who joined us today. Mark your calendars for our next Wellness Wednesday event on Wednesday, March 9th at 12:15. Have a great day, everyone.